I will give the shirt off my back if someone needs it. I also believe that what you give in life, you get back. I'm a recreation therapist in a home in White Rock, and I do programs for the seniors. My programs kind of have a little bit every day just to help them stay healthy physically and mentally. And then, of course, the pet therapy, bringing the animals in, which is huge with them. Hey, let's do this way. Turn this way. There, he's a good boy. When I got Monkey, I had just had surgery on my second knee. I was still in a lot of pain, and I hadn't been working. So I was homebound, which is not me. And so he was a comfort to me. I met Brenda through a home business called Princess House. For some reason, we just kind of clicked. We're good friends. If she needs me, all she has to do is phone. If I don't hear from her during the week, at least once a week, I will be phoning her and I will be asking her, what's going on? Are you okay? Do you need anything? And then other days I just pick her up and we go shopping. It goes both ways. There are times when I've had one heck of a day at work or week, and I can phone and just vent, and she's there to listen. And then she needed help with an event.
We're planning the event for June 26th.
The first time I went, there was doctors there to answer questions from people. That was great because you need that. You need a professional to say, these are the symptoms, this is what to expect, this is what we have available for you.
You're the one that has the most knowledge out of all the volunteers who volunteers without having lupus, without having the firm diagnosis of lupus.
And because with lupus, it's not diagnosed properly in some cases. And by the time they get help, they've gone through a lot. If you can get help right away and get the symptoms under control and find out what your trigger points are, I think it would make a world of difference. And the symposium does that, I think, for a lot of people. When I volunteer, I get to know more and more about lupus. And the more I get to know, the more I understand Brenda and understand what her needs are.
Brain fog is when you just...
the words are there, but they're just not coming out.
Yeah.
And it's almost like a stutter sometimes with you. When I hit my 40s, I noticed that I was having problems with my shoulders. My back was starting to really bother me a little bit. My knees went, and then I started getting like blisters. They would hurt and itch, and so at night I was scratching, and of course, now I've got lots of scars. And it seemed to start from one arm, go up across my back, down the other arm. Then my face went crazy to the point where the whole face was just red and billions of little pimples, and I couldn't see properly because my eyes were almost shut. And I went into Emerge that day, and I guess they gave me antihistamines or something, and it calmed it down enough where I could function. But I don't think we really ever got a diagnosis, because by the time you get in, it calms down. So all you have is pictures. And I tell you, I'm glad I've got pictures, because when I showed him, he was like, next time it gets that bad, you phone and we'll get you in right away. Unfortunately, that didn't happen when I phoned. And I do know that he's extremely busy, and I understand that. So then I went to another one. He says, oh, it's severe rosacea. And I'm like, but that doesn't explain all the blisters. I just thought it was not a correct diagnosis. The first doctor doesn't believe it's lupus. But talking to Brenda, and she loves to research. And she says that she felt that it was a form of lupus in the skin. But we all know how hard it is to diagnose lupus, because you got to go through everything else before you say, that's what it is. I hope it's not lupus, but in some ways you just hope that you can get the diagnosis so that you can move on. I just have to deal with it the best I can. I can't use Polysporin, I can't use Bacroban. You have to come up with a solution. And I remember an acquaintance saying to me, have you tried using vitamin E, Eucalyptus oil, and Aloe Vera plant?
And this is for your to help with the
when I break
sores
out.
with your.
Yeah. So the eucalyptus apparently is like a disinfectant. It'll clean it, get rid of the poisons, and the vitamin E, of course, helps. And the aloe vera is a soothing gel. I still don't heal overnight. No, it takes a while sometimes, but I'll just use a Q-tip. You don't use your fingers, but you can tell I'm a gardener. You know what it reminds me of.
Yeah, I know what it reminds me of.
When you're walking with your honey and your nose is kind of runny and you think it's rather funny, well, it's not. I have quite a vegetable garden I put out every year, and we never eat it. But my neighbors all get to, and their families get to. So it's kind of I like to watch things grow. If you have an abundance, why not give it out to those who need? I enjoy doing that. And I like the fact that people are thankful. I love it when they bloom. It's this purple flower. And then we got some cucumber. And then on the other side, we have lettuce and zucchini and rhubarb. And actually, this is an old bed frame that I found on the side of the road. And I thought, oh, my zucchini can crawl up and over it, right? A lot of doctors, and they're so overwhelmed with the system right now, and they have so many patients, you can't even find a full-time doctor anymore. So if you can't find a full-time doctor and you're going from one clinic to another, who's keeping track of you? And so I think it's the medical system. Honestly, we don't have enough doctors. And when we do have the doctors, there's so much for them and there's so many people for them to look after that they want to see as many as they can. And so the quickest diagnosis is the best. And I think that the more lupus gets out there and they're in people's forefront and they see the signs and they see the information about lupus and the people with lupus and what they struggle with, the more that comes out, I think the better diagnosis in the long run.